Scurvy, a disease through the centuries. Introduction. Scurvy, stemming from vitamin C deficiency, was first noted in 1550 BC by ancient Egyptian medical practitioners and gained notoriety in the pirate era. In the 1700s, British Royal Navy surgeon James Lind found that consuming lemons and oranges improved symptoms of the disease. Despite its ancient discovery and simple treatment, scurvy cases persist today, posing a diagnostic challenge due to its rarity. Case presentation: a 64-year-old female with a history of chronic normocytic anemia and obesity, status post-robotic gastric bypass in 2021, presented with bilateral lower extremity edema, spontaneous bruises, and a rash on her lower extremities. The patient noticed blisters on her feet a few weeks before presentation, a rash on her legs, and spontaneous bruising on her upper extremities. She self-medicated with hydrocortisone cream, which was ineffective. She reported a poor diet, low protein intake, a 100-pound weight loss over 2 years, and difficulty tolerating foods after her gastric bypass. Physical exam: bilateral upper extremity bruises and areas of perifollicular hyperkeratosis, petechiae, and purpura on both lower extremities with bilateral leg edema. The weight on admission was 114 kilograms. Labs on admission: total protein was 4.2 grams per deciliter, albumin was 1.9 grams per deciliter, hemoglobin was 10.8 grams per deciliter, platelet count was 257 thousandths per cubic millimeter, and INR was 1.2 with no evidence of proteinuria. The vitamin C level, which was tested on admission, came back as 0.3 mg per deciliter, normal range 0.6 to 2.0 mg per deciliter. Scurvy was suspected, and the patient was empirically started on 500 mg of ascorbic acid orally daily. Case continued. Figure A: lower extremity petechiae and perifollicular hyperkeratosis. Figure B: bruises on the upper extremity. Discussion: scurvy is a very rare presentation in developed countries. However, it's estimated that 5.9% of the United States population has a vitamin C deficiency. Vitamin C plays a key role in preserving collagen's triple helical structure through the hydroxylation of proline and lysine residues. Collagen is vital for blood vessel integrity, and its disruption leads to weakened, leaky vessels manifesting as abnormal bruising and a petechial rash, as observed in our patient. Skin findings also include follicular hyperkeratosis and xerosis. Patients also experience coiled hair and gingivitis. Musculoskeletal manifestations include arthralgias, typically of the knees, ankles, and wrists, myalgias, hamarthrosis, and muscular hematomas. Diagnostic evaluation for scurvy includes checking vitamin C levels, with symptoms appearing when plasma ascorbic acid falls below 0.2 mg per deciliter. Exceptions can occur, as was seen in our case, and clinical judgment should take precedence, guiding decisions beyond numerical thresholds. The treatment for scurvy is to give 300 to 1,000 mg of ascorbic acid daily for a month in adults. Scurvy is an uncommon condition in the modern era. However, despite being recognized since ancient times and having a straightforward treatment, cases persist today, presenting a diagnostic challenge due to their infrequency. Therefore, it's crucial to be aware of scurvy's clinical presentation and consider it in the differential diagnoses, especially for patients with limited food access, malabsorption disorders, or a history of bariatric surgeries.